Beginning with the name of Allah, the most merciful, the most beneficent. This is me, Pir Farmanullah. Today we will talk about the adrenergic and cholinergic systems. We will discuss about it, the adrenergic and cholinergic system. It is a very important in pharmacology. Today we will talk about the receptors. Receptor is made of which things. Also we will talk about the receptor, which receptor is present at which area. So okay, let me to start about today the adrenergic systems, and I will tell you where the receptor is present at the various part of human tissue inside the body. So here is adrenergic systems. Adrenergic systems. Before adrenergic, we will talk about the one another things. Okay, pharmacology having a different subgroups or sub branches or subjects. One is pharmacokinetics, one is pharmacodynamic, another is posology, toxicology, and so many another subjects and subtitles of that pharmacology. So okay, we will discuss about the pharmacodynamic. One is pharmacokinetic. Pharmacokinetic is a branch of pharmacology which deals with the drugs movement mechanism, drug movements, the drugs motility inside a body, the movements, the drugs which are doing. Suppose to say, if you are taking magnesium and HCl's, magnesium chloride or HCl hydrochloric acids, so it becomes interact to each others, and the magnesium chloride, it is excreted to guts of any body, of a person body, of a patient body. So it is a gastric antacid also, and it is also used for the HCl antacid also, the magnesiums. So like the strepsils and supposed to say another or some tablets like the mucanes and another like these things. Because here with mucane you will study about the mucane. Mucane is the combination of aluminium oxide and magnesium's hydroxide. Aluminium oxide basically create constipations. Aluminium oxide basically creates constipation, while the magnesium's hydrochloride or the magnesium's you shouldn't use the magnesium oxide only. Okay, keep it in your mind, because magnesium oxide creates toxicity inside the body. Magnesium hydroxide, magnesium sulfide, like this type of compounds you will use, not only magnesium oxide, hydroxide. Okay, so another one thinks that the aluminium hydroxide which create a constipation inside the body. Another one is aluminium hydroxide create constipation, while the magnesium persulfate, magnesium sulfate, magnesium hydrochloride causing the laxative properties. Okay, so it is a short video for my pharmacology students. Also this video for my students who are going to appear in DOH exams, like the MOH exam, FPG exams, NIPLEX exams. Another one like the Canadians, supposed to like the Canadians equivalency examinations, Canadians qualification exams, step 1, step 2, NIPLEX, FI exams, All Pharmacy Association of Americans, another one for the state exams. So this pharmacology, this topic is a very important. This topic playing a very important role inside these MCQs, which comes in international examinations MCQs. So today we will study about the major things we will study about is basically cells. Okay, cell is the basic and building blocks of any organism, of any subjects. Okay, all the receptors. Receptor is made of proteins and glycates to some extent. Also there is receptors which is present in the tissue of human body. Okay, so this mechanism of action of drugs comes inside mechanism of drugs which come inside pharmacodynamics. Okay, but pharmacokinetics is the movement of the drug, as I told you before, some movements. Okay, so let me to start about the pharmacodynamic. Inside pharmacodynamic we will start receptors. Okay, there are 3 type of receptors. Okay, there are 3 type of systems inside pharmacodynamics. And one is adrenergic receptors, and another one is cholinergic, and third one is histaminergic. Okay, so we'll start about adrenergic. So this is adrenergic. Adrenergic is composed of which thing? Adrenergic is composed of things of alpha 1. Okay, another one is alpha 1, alpha 2, another one is beta 1, third one is beta 2. So we will study about all these things. Okay, it is alpha 1, alpha 2, beta 1, beta 2. Alpha 1 is present where at the arterial site of blood vessels, or it is present at blood vessels. Alpha 1 is present. Okay? Alpha is present at the arterial site of vessels. Arterial site of vessels. I'm not going to write many theory because the video will become very extended, so it will be unable to send to your friends, to your colleagues, to your another students. Okay, to these reasons I am writing in a very simplistic form, in a passive form. Okay, so it is alpha receptor is present in the arterial site. Okay, another one are in the blood vessels. Okay, because receptor present at tissues. Receptor present at tissues. Okay, so it is present here. Alpha 1, beta 1 is present at heart. Okay, and beta 2 is present at lungs plus uterus. Okay, uterus. So what is the function of alpha 1 agonistic? There are the two terminologies. My friend, my pharmacist colleagues are becoming confused in these two terminologies, in these two things. One is agonistic property, another is antagonistic property. Agonistic properties which have a property to activation of that receptors. It means you are going to activate that receptor functions. One is antagonistic. Antagonistic means you are going to blockage of that receptor's activities. Okay, or that receptor activities. Suppose to say we have some drugs, they are used for the antagonistic properties, or some we have drugs they are used for the antagonistic properties. Suppose to say if we have some drugs, they are alpha agonistic. So if we have drugs we use to a patient, that drugs which has alpha agonistic properties, supposed to say epinephrine. Epinephrine has a functions which increase the alpha receptor activities. Okay, it is alpha agonistic properties. So when it alpha receptor is activated, so there will be vasoconstrictions. Okay, if the vasoconstriction will create, it will increase the blood pressure of patient. So this is the properties of that drugs, that epinephrine's or epinephrine injections also present in a form nap injections. Okay, so the alpha 1 agonistic properties having those type of drugs who have increased the effect of, who have activation the effect of alpha receptor is called alpha agonistic properties. Those type of drugs which has a property to antagonize, to blockage the function, the effects of alpha is called antagonistic property. Okay, so when the antagonistic property we are going to giving the drugs to a patient who has antagonistic property, so they will block the effect of that alpha 1 receptors. When the alpha 1 receptor is activated, so there will be a vasoconstrictions. When vasoconstrictions will activate it, when it will occur, it will increase the blood pressure of patient. Okay, so we should care about such type of drugs. Okay, another is antagonistic. Antagonistic drug for alpha 1 we have there are pentolamine is a good drugs which is used for the arterial pressure. It decrease. It has a property of alpha 1 antagonistic properties. Okay, so it is a banned, I think, inside a market. So when this drug we use, which increase, so if you use phentolamine drugs, so it will decrease blood pressure because it has a function of alpha 1 antagonistic properties. When we will antagonize the alpha 1 receptor, so what will occur? Vasodilation will occur. Okay, there will be no BP will become down. Okay, BP will become down. Another one is also we have beta 1 receptors. Beta 1 receptor is present at heart. Okay, we have four channels inside here, or the four channels when we are going to study about the when we are going to study about the patient having angina pectoris and also arrhythmia patient. So we are giving the four classes of drugs. Which type of four classes of drugs? We are giving the number one sodium channel blockers or membrane stabilizers. Another one is beta blockers. Okay, in the sodium channel blockers we have so many drugs, prozosins and like these types. Okay, another one prozosins, also it is used for the arterial fibrillations. Okay, probinafines, like this type of pronunciation I forget, but it is the probifenoin. Okay, now I understand. Probifenoin, okay, which is used for the sodium channel blocker or membrane stabilizers. Another one is a beta blocker. Beta having two things. Number one, beta 1 and beta 2, selective and non-selective. In beta 1 we giving the etenolol, in beta 2 we are giving the propranolol and like this type of drugs. Third one is a potassium channel blocker. Potassium channel blocker is amidoron's. Okay, and fourth one is a calcium channel blocker. Calcium channel blocker is anifidipines. So we have four classes which is used for the angina pectoris and like for the arrhythmia drugs and like this thing. So we must we must care about the selection of such type of drugs. Okay. So now I will study about the beta 1. Beta 1 is present in heart when the beta 1 receptor activated. So there will be increase the heart rate. Tachycardia will cause at that time or at that area. So when the tachycardia will increase, will cause, so there will be the contraction and relaxation of heart. Okay. So it is a beta 1. So we are going to give a drug, specific drug, which is a beta 1 antagonistic properties. Is which type of drug is atenolol. Okay, but there are so many cases we will study about the cases.